Welcome to our presentation of the Alliance Project. My name is Dr. Michael Nadorff, and I'm joined by Dr. Emily Stafford and Ms. Rachel-Clair Franklin. So we are all at Mississippi State University in the Department of Psychology. And this is a training, it's a suicide prevention training that we've been doing all over the state as part of a grant from the Department of Mental Health. And since we can't come to you in person right now, we wanted to bring you this training virtually. So hopefully you'll find this helpful during this challenging COVID-19 quarantine time. So the goal for today is to help you learn how to identify individuals who are in distress, how to make a connection with those individuals, how to really intently listen, and learn how best to help them, which almost always is making some type of referral. So what we're not trying to do is help, teach you how to be a counselor or a psychologist. We're not trying to deputize you to be a mental health professional. But again, rather, we're really having you focus on how is it that you can be the best friend possible? How can you, be that really intent listener who can really get, help identify what it is that is going on in order to help make that connection. So that's going to be the goal of our training today. So why is it important? Well, a lot of reasons. So first of all, our most recent statistics from 2018 tell us that suicide's the 10th leading cause of death overall. And it's the second leading cause of death for teens and adolescents, all the way up into early adulthood. And in total, 48,000 people died by suicide in 2018. Now, this seems like a big number because it is a big number, but just to give you perspective on it, this is more than the number of people that die in auto accidents. This is twice the number of people that are murdered nationwide. So this is a very large number of people that die by suicide. And of course, right now, given the challenges we're facing with all of us being quarantined, that's why all of us are presenting from different locations. Obviously, we worry about whether or not these stressors are going to possibly lead more people to consider suicide. So that's another reason why this training is so important right now. Another reason why we believe it's really important is because there are simply not enough mental health providers in the state. So, for instance, we looked at the licensed psychiatrists who actually have a Mississippi address, because you can be licensed here and not live here. And we found that there are only 233 psychiatrists in Mississippi. Likewise, for psychologists like myself, there's only one psychologist for roughly every 8,000 people in Mississippi. We simply don't have enough providers that we are going to be able to identify everyone at risk. So with this, it's really important to have lay people, non-mental health professionals, help in aiding us in identifying who is at risk and who is not. So speaking of which, just one favor to us as far as the training. So I anticipate most of you are coming in as lay individuals, and that's perfect. If you're not, if you're a healthcare professional or if you're a mental health care professional, this training should still be helpful. If you would email Rachel-Clair Franklin, her email will be at the end of the presentation, and let us know. It actually helps for grant accounting. So just wanted to throw that in there. But regardless, you're in the right place. So this is looking at suicide deaths in Mississippi. And as you can see, there are, it's all over. You can see that certainly you have higher rates in the Jackson area down by the coast. Basically, your higher population centers, which makes sense. But still, this is a problem everywhere. There's nowhere that's not being touched. No county that hasn't been touched in the last several years by suicide in the state. So looking at risk factors that we commonly see, Certainly, bullying is becoming more and more of one. One that's really worth noting right now is the lack of connectedness. And this is going to be a challenge for us while all of us are in quarantine. Um, these are different times, and it's different. Even though the technology helps a lot, it's different not actually being able to be with people and just to see them through a screen. And but we do know that feelings of disconnectedness are a very strong predictor of suicidality. So it's so important for us right now to reach out to each other and stay connected, even though it's, this time of social distancing. That the term or the word social, and that's really a misnomer. Um, Even though we need to be apart, it's really physical distancing, but we want to stay connected. We want to, keep those supports. They're so helpful for getting through stressful times like this. Of course, many of us are dealing with unemployment. For youth, it's parental unemployment. For others, it may be our own unemployment or just threat that businesses may not get through. Um, and of course, you have your normal risk factors that you've likely heard of and thought about, like mental health problems, history of suicide attempt, a lot of different stressors that can go into leading someone to consider suicide as an option. So looking at data in Mississippi, one of the things that really amazes people is just how prevalent suicidal behavior is. So if you look at high school students, 17%, so 1 in 6, seriously considered attempting suicide in the last year. 1 in 7 actually made a plan, and about 1 in 8 high school students actually attempted suicide. So this is happening, and you may not know it because a lot of these attempts thankfully don't require hospitalization, but plenty do. And certainly the chance of death is there. So, our focus is what this project has been on high school students and adolescents. But again, during this time, there are many people at risk, from just across the lifespan. So just be aware that this is actually going on. And when someone talks about suicide, if the thought comes up, if the topic comes up, that it very well might be serious. It may not be a joke. Again, just another way to look at it with statistics. It's estimated that there's a youth suicide in Mississippi, just specifically Mississippi, every 7.6 days, so every week. And with this, over the last 10 years, there have been 516 youth suicides all over Mississippi. So one of the things that people often worry about is whether or not asking about suicidal thoughts will lead someone to act upon those thoughts. And thankfully, there's been a good amount of research on this across the lifespan. And what we know is that, no, it does not increase the risk of suicide. So asking about suicide actually might reduce risk, it seems, in some studies, in part because it takes away some of the stigma about it. So our training is not focused on asking about suicide. But with this, we want you to feel, if you do want to ask about suicide, that you're able to do so. So with this, what does this all look like in real life? So what we know is, obviously we talked about a lot of the negative stressors and many of those stressors we're experiencing right now and anxiety we're experiencing. But one of the things that is also important to consider is that there are also positive stressors or good stressors. And I don't mean to say positive in that they are helpful stressors, but even good events can come with stress. So it's important to realize that just because someone might be going through something good, like planning a wedding or approaching graduation, doesn't necessarily mean that can't actually be stressful and increase risk. Other risk factors that we see that are very common for suicide is sleep problems, feeling helpless or worthless, Again, that social withdrawal that's going to be so challenging right now with the social distancing, and feeling like you're a burden on others, or that you don't belong. So this is going to be, there's several major stressors with COVID right now. Certainly, if you get sick, you might feel like you're a burden, and you may have those feelings of helplessness. So we need to be aware of that, and also be aware that those who do get sick during this time might be at increased risk and are worthy of being checked in with. And also that lack of belongingness. It's so easy when we're so worried about things, worried about our own family, for people to be out of sight, out of mind, and for us not to realize that our neighbors might be struggling, our friends might be struggling, our employees, our employers. So just keeping those factors in mind. And again, stressors can be good or bad. So just remembering that, for instance, major holidays can be wonderful things, but also when families coming in and there's planning and preparation, there's just a lot to do, and that can sometimes lead to stress. So our project's going to go through 5 steps that are going to be helpful for working through this, and it'll be identifying distress, breaking the ice with a person, building rapport, sharing information and making a plan, and then following up. So at that, I'm going to turn over to Rachel-Clair Franklin, and she will take it from here.
So the first step is identifying distress. And so when we talk about identifying distress, I want you to think about ways in which you may communicate to your friends, your family members, or folks that you're around a lot of the time, how you're feeling overwhelmed. Do you, start to withdraw? Do you become more active? Just think about ways in which you express kind of your personal state of being to those around you. And what that will do is it will give you the ability to start kind of thinking about acknowledging and noticing and observing maybe other people's behaviors, and when maybe some of those behaviors may start to become concerning. So just take a few seconds to think about these 2 questions for yourself. So we're going to take a scenario here, and we'll use this scenario throughout the rest of the training presentation. So one of your close friends, Sam, is experiencing a great deal of distress related to fears of furlough during this time of uncertainty. Sam's family lives paycheck to paycheck. Sam's family includes Alex, a high school senior. Sam discloses to you some worrying behavior, such as Alex is no longer reaching out to friends, has been staying up until about 4 o'clock in the morning, and is sleeping all day. And Alex has recently mentioned that there's no point in doing anything because his senior year is canceled. And so we're going to utilize this scenario as we kind of move through the steps as an example to kind of make this a little bit more relatable. So taking a look at our scenario again, what are some things that you initially notice that may be concerning for you in regards to Sam or Alex?
Rachel-Clair, I would say one of the things that stands out for me is Alex has started to withdraw from friends and is no longer maybe talking with those friends on the phone or doing FaceTime, but has really started to withdraw.
Certainly.
Yeah. The sleep and changes in sleep certainly also are concerning.
What about for Sam?
I think many of us that are experiencing the lockdown or the quarantine and not being able to go to work during this period of time is very stressful on our families, thinking about how we're going to pay the bills, what's work going to look like when we return to work. Or perhaps there are some of us that are essential employees that are having to go to work during this global pandemic. That in itself is very stressful.
Excellent. So the next step we're going to take a look at is the break in the ice step. So for the second step, the break in the ice step in the Alliance Project, one thing we really want to point out here and pay attention to is that when you are speaking with someone, whether you know them or not, when you're speaking of concern about an individual, it's going to feel a little bit uncomfortable. It doesn't matter if it's somebody you're living in your home with or one of your really good friends or an extended family member or even a stranger. It's okay to acknowledge that it's going to be a little bit uncomfortable no matter what. And so these are just a few ways in which to think about how you might break the ice with someone that you come in contact with, whether you know them or not. And so we've got introducing yourself, obviously, is always, a good way to start a conversation with someone. Inviting someone into a conversation, asking them how they're doing, and a big one here is reviewing concerning statements or behaviors. And so these are going to be things and statements like, I heard you say that you don't really want to be around many of your friends right now, or I noticed that you're staying up until 4 o'clock in the morning, and that's not something that you typically do. And so those observable behaviors that you can point out to individuals that you're concerned about are really important because they're not accusatory, and they're not very harsh. It's just, hey, I noticed this is going on. Tell me a little bit more about that. And so kind of think about ways in which you can utilize those observable behaviors when you are engaging with someone you're concerned about.
I think another thing that always helps me with breaking the ice is sometimes being forthcoming about myself and revealing some about me, which, this may or may not fit with you. So don't do it if it's not true for you. But especially right now, it's easy to say, it's been really tough being in quarantine, and it's challenging. It's brought new stressors. How have you been doing with it? And sometimes by talking about how it's been a challenge for you, it makes it easier for someone else to come in and talk about their challenges too.
So going back to our scenario with Sam and Alex, what are some ways in which you might potentially try to break the ice with Sam or Alex?
Rachel-Clair, I've seen that several classes of students in the K through 12 have been doing like Zoom or Webex or Skype coffee times with teachers or with other people in class. So you get your favorite beverage and you go do a little chit-chat meeting with the rest of the people in your class, and you all have your beverage together.
Excellent.
And a lot of these check-ins don't have to be, it helps when it's on the phone or, via a system like this where you can see each other. But you can also, do some of this via text as well, just saying, hey, just wondering how you're holding up. Yeah, I know it's been a challenge for me. And see how the response is. And then if there's someone that is, seeming lonely that way, or if you see something concerning on Facebook or another social media platform, reaching out to them and just, trying to engage them to make sure that they have that social connection.
Certainly. Are there any other ways you might identify that would be helpful in regards to breaking the ice with your friend Sam here or Alex?
I really like the idea, as Dr. Nadorff mentioned, kind of talking about making that connection and talking about how you can identify a little bit with what that family is perhaps going through. While you'll never understand exactly what they're going through because every person has their own unique experience, you can kind of form that relationship a little bit if perhaps you're experiencing similar things. So, for example, I know that there's a young child in my house and there's a young child in Dr. Nadorff's house. So there might be some similarities there that we could just talk about. What are we doing with the kids when they're out of school? So something to think about.
Mm-hmm.
Excellent. So the biggest thing that I particularly want you to remember again about breaking the ice is that it's okay, and it's going to be a little uncomfortable, and that it's okay to lean into that uncomfortableness just a little bit. So with that, we'll move on to the third step, and I will hand it over to Dr. Emily Stafford.
Thank you. So with the third step in the Alliance Project, we want people to focus on building that relationship, building that connection with the people who are around them. And so what we've done is we've listed some skills here that are helpful in building that relationship. So obviously, if you're in quarantine and you're speaking with someone in your family, there's a likely chance that you have a pretty solid relationship with them. But if you're perhaps reaching out to someone through text message or FaceTime that you don't know as well, you might want some skills that can help build that relationship. So we've included those here. Those would be things like being uncommonly attentive. So when you're having a conversation with another person and it's face-to-face, so if you were on FaceTime or Skype, you're going to notice if that person isn't giving you their undivided attention in that conversation. If perhaps they're intermittently talking off to people in the distance, or if it's obvious that they're watching television, or if perhaps you're having a conversation on the computer, but they have their cell phone and it's very obvious that they're looking at Facebook on their cell phone and not giving that undivided attention in that conversation. Those types of behaviors chip away at building that relationship. So you want to make sure that when you're checking in with that person that you're concerned about, that you're really giving them your full undivided attention. Some of the other things that we like people to try to do is find the similarities, because they can help build the relationship as well. So finding common ground with that individual. So I mentioned before, there's a young child in my house, there's a young child in Dr. Nadorff's house, and prior to COVID-19, the kids would play together sometimes. And so it's easy for our two families to talk about stuff related to small kids, because that's something that we have in common. If perhaps there is another friend that you might want to check in. So Rachel-Clair, if I was checking in with you, I know you have a dog. And so we might talk about all the things that you're doing with your pet during quarantine. Or if perhaps you knew that the person was fond of painting, you might ask them if they've had any new projects, if they've done any new paintings during this time away from work. So you can find those things that you have an interest in and they have an interest in, and kind of start there, because you start small and build that relationship. So as you're making those different connections and talking about common ground with people, you might pick an area of your life that many people can identify with. So for example, you see on your screen here a dog. Penelope is much beloved by my family and is a 22-pound, fully grown adult dog, but she looks a little bit like a puppy. So you can see here in the picture, we love her big ears as well. And Penelope loves to chew on things and loves to run and play, and has chewed on at least 2 television remote controls. We are on our 3rd in our house. And so I have lots and lots of stories I could share with you about Penelope the dog that might entertain you during this time. So that's just an example of kind of a small thing that you can do to help make that connection with someone. Or if perhaps they enjoyed dog stories and you knew that, you might regale them with stories of the dog. So as we start to build these skills to build rapport with one another, particularly with people, you want to build that rapport through a digital platform, through an electronic platform, because you may not be able to see them face to face. In order to help you practice those skills, there's a game that we like to play when we do this presentation in person called I Connect. And the way that you play this game and help people practice those rapport building skills is you start to tell, one person in the group starts to tell a story about themselves. So for example, I just told you about Penelope the dog and how she loves to chew on television remote controls, and she loves to run outside and play and jump. And I would tell you that story that's relevant to me. And when you felt like you had a connection with that story, so perhaps you also have a dog, or perhaps there's another pet within your family that enjoys destroying things or chewing on things, and you felt that connection, the next person in the group would say, I connect, and would start to talk about how they connect, talk about themselves, and to share a little bit of information about themselves to help build that rapport. And eventually, if you are doing this exercise in small groups, if we were doing this presentation face-to-face, it would make it all the way around the circle, and everyone would see the different connections that there are in the group. Because a lot of times there might be something there and you may not realize it. So that's why we like to do this activity when we have the ability to meet in small groups. So I thought if we wanted to just demonstrate the activity, we could go around here with the presenters. And I shared a little bit of information about Penelope and how she likes to chew on things. And I wonder if anybody had a connection with that story.
I would definitely say I connect, as I have a 13-year-old Chihuahua who will eat anything and everything, no matter if it's edible or not.
And I have a connection too, because I have two dogs, one of which is a 1-year-old golden retriever. And another thing that a lot of people have been experiencing lately is, especially with quarantine, is changes or difficulty with sleeping, or just changes with their sleeping schedule. And for me, I actually haven't had as much because the golden retriever is my alarm clock. He will wake me up and make sure that we get out and we go on a walk. But I was wondering if anyone else has had changes either with sleeping or eating or just other normal patterns of their lives.
I connect with that. My bedtime has been pushed back, I would say, by probably an hour or two, because I'm getting to sleep in a little bit later in the morning, because to be at work at 8 o'clock, I just have to turn on my computer. So I don't need as much time in the morning to perhaps get ready for work and commute as I needed to in the past. So that's, if I'm waking up later, it means I'm going to bed later, and my sleep has definitely been impacted as well.
Definitely. I will definitely connect with that as well. My bedtime has been pushed back probably 4 or 5 hours, and sleeping in maybe 1 or 2 more hours. So definitely connect with that.
Mm-hmm. I think that's sleep, and maybe even food too. The types of food that you're eating, I know, has definitely changed in our household, just because it's a little tougher to get out to the store and perhaps find what you need immediately. So although we do have a little bit more time to cook now. So
It seems it's either helped your diet or made it a lot worse, depending on the person. There's very little in between.
Yeah, we've had a little bit of both. We made oatmeal craisin cookies the other day, and my child said that he would like to engage in that activity again soon. So we'll see.
Awesome.
So we played I Connect and talked about all the different connections that the different presenters have. And I want to shift back and think about our vignette. So thinking back to Sam's family and Alex, who's our high school senior, what are some different ways that you might connect with them and show support to your friend's family during this time of quarantine? So Rachel-Clair, I'm curious, what would you do if you were friends with Sam?
Well, I think that the big thing that sticks out for me is probably in regards to building rapport with Alex. I know you asked about Sam, but with Alex, I am definitely experiencing a depletion of things in my life that I enjoy, which has been really challenging. And so I feel like with Alex, I could definitely connect with Alex on that level. And with Sam in regards to building rapport, while I don't have children, and I'm not at this moment risking being furloughed at this time, I think that pointing out, anything that's going on in regards to lack of or fear of or anxiety about particular things that we don't know what the answer is going to be to those questions and fears and anxieties. I feel like I could definitely try to build rapport with Sam in regards to that, just that the fear of not knowing.
Yeah, absolutely. I mean, there's so much we have in common right now because of this. Whether it's the anxieties or just, all of us, staying indoors, the social distancing, we're all in the state about to be under the same, mandatory orders to stay home, stay inside. So with that, we have some common experiences that we can talk about, even if it's just, talking about, some of the changes or some of the struggles of just not being able to go out when you want to or have the freedom that you normally have.
Mm-hmm. And I think even if you can identify some of what the person is experiencing, maybe not the whole picture, like, for example, if perhaps your job at this time is not in jeopardy or whatever the case may be, sometimes you can just listen to the person as they talk about their fears, they talk about their anxieties, and that in itself can help build rapport because it strengthens that relationship. So just being that listening ear can strengthen that relationship as well. So there are a lot of commonalities, but sometimes your friend who's in distress might just want a listening ear. So those are all really good suggestions. Thank you. So at this point in the presentation, as you're building all of that wonderful rapport, we'd like to take a moment and pause and think about what happens if you say something that you didn't mean to say. So a lot of times when you're trying to provide comfort to someone, you're trying to build a relationship with someone, you might say something accidentally or it comes out wrong, not quite how you meant it to, and you're concerned that perhaps you might be seen as disingenuous by your friend, or that you might have hurt their feelings, or something just didn't come out like you wanted it to. So we want to encourage you that if that happens, acknowledge it, apologize to your friend. Just say, oh my goodness, when we were talking the other day about how you felt about Alex and your concern, I said something and it just didn't come out right. And that's not how I meant it. And I want you to know that I'm sorry for that. And I wondered if we could start over again. Like, tell me what's going on, and I'm going to be a better listener. So just acknowledging that you made a mistake, that you misspoke, apologizing for that error, and then trying to reconnect with that person. So having a conversation to kind of follow up about it, because we all make mistakes, or we all say things that either came out wrong or we didn't mean. And sometimes people say things when they're nervous. If it's a conversation topic that makes you really nervous, if Sam is talking about how he's really concerned about Alex's safety, and perhaps you say something like, oh, it'll be fine, he'll get through it. And you were trying to be comforting, but in that moment, Sam felt that you were kind of brushing off their feelings, that you weren't really listening or acknowledging the feelings. That might be a time that you might acknowledge that perhaps you didn't have on your best listening ears and you want to try to do better in the future. Some other things that are not going to be helpful if the conversation turns towards self-harm or towards suicide is if you are having a debate with the person over the value of life or some of the philosophical implications that go along with that. Right now in that moment, that person is really hurting and is reaching out for assistance. So having a debate about suicide or life and death is probably not going to be most helpful to that person in that moment. So we'd like you to do some other things that we're going to talk about in step 4, rather than have a debate or an argument with them. Statements like, you wouldn't do anything stupid, would you? Are also probably not very helpful in that moment. They might accidentally come off as judgy or discounting the other person's feelings. And again, you really want to focus in on that person and hear them when they're in pain rather than minimizing those feelings. Some of the other things that are less than helpful when you're having this type of conversation with your friends or your family members, being sworn to secrecy is not helpful in the moment, because if you're really concerned for the person's safety, we want to reach out and make sure that they get the help that they need. And if you're sworn to secrecy, when it comes to life and death issues, that may not be the appropriate time to hold that person's secret if they're going to tell you that they're having thoughts of hurting themselves or hurting someone else. So, and then the last one is acting shocked if the person discloses that perhaps they've self-injured in the past, or they've perhaps attempted to end their life in the past. So as Dr. Nadorff mentioned at the beginning of the presentation, there are lots and lots of people in our state who have had thoughts of harming themselves, who have thoughts about wanting to no longer be here, who have perhaps attempted on their own life. So because it's so common, if you have a very shocked reaction, then that person might feel like they're not able to disclose those things to you or talk to you about those things because you kind of had that shocked reaction, and they might feel kind of judged. So those are just all things to keep in mind as you're having what might be a very challenging conversation with a family member or with a friend. So our next step, what you can do to help this person, we want to share a little bit with you about how to provide some information to them and how to make a plan. So when we think about making a plan with someone, we want to identify the different needs that they have. So you want to try to think from Sam or Alex's perspective and identify the different needs that may be there, because those needs might be different than the needs that you identify, what you think that they need. So there are different ways of kind of looking at the needs and what might be beneficial in the situation. We also want to keep in mind that help can come in many ways. So that might involve going to visit a healthcare professional if safety is a concern, who's able to travel. If Alex perhaps needs to go see a healthcare professional, who's going to go with Alex? Will it be somebody? Will it be Sam? Will it be somebody else in the family? We can also consider who it is that might be trusted to be brought into this situation. So if we know that Alex has a very good relationship, perhaps with a teacher at school, or if there's a best friend, we might consider reaching out to those people who are really important in Alex's life. And, maybe perhaps keeping in mind what Alex wants to share and perhaps what Alex does not want to share, and not share more than Alex desires unless safety is a concern. But we might think about ways that we can bring in that teacher or perhaps a sports coach digitally now, since we're all sheltering at home, and how we can kind of get Alex to be have a feeling of more connectedness with people that Alex cares about. So
I think there are a couple other things just worth bringing up given the current environment. Having talked to some people in distress very recently, actually, one of the things that I've noticed a lot of is some people having some guilt about struggling during these times when they're not sick. And, it's like, why is it that, I'm struggling so much and I don't even have anything wrong with me? And I've also seen similar individuals where they've said, I can't seek help right now because, the hospitals are all overrun. There's, too much going on. And with that, I think it's important to remember that you still can reach out and still should reach out. And mental health is quickly trying to find our way to adapt to these times too. So many practitioners have moved over to telehealth. Our clinic is actually in the process of doing so right now. We don't want you to feel like you can't reach out for help just because we have all the other COVID-19 stuff going around, it's still, yeah, if you need help, you still should reach out.
So we want to think about what are some of the different resources that we can share with Sam or with Alex. So what we've done is we've listed some of our statewide resources for the state of Mississippi. As you can see here on this map, every county within the state of Mississippi falls into a particular region that is served by the Mississippi Department of Mental Health. So you can find your county on this map and see what region you fall into. And once you know that, you can access the contact information for that region. So you can see here what we've done is we've split up the different regions and demonstrated which county is associated with each region and the contact information for that particular region. So for example, Region 1 is located, their main office is located in Clarksdale, Mississippi, and you can see their website there, and you can see their phone number there, and you can see the counties that are served by Region 1. So that's going to be your largest community access for community mental health services. Of course, you also do still have within the state of Mississippi the private practitioners and some of the other smaller agencies, but the different regions that fall under community mental health are going to be your most comprehensive resources at this time. What we've got here are regions 8 through 12, so I'll give you a few seconds to look over those slides, and perhaps you belong to one of these counties and you are interested in information for those particular regions. And then lastly, we've got regions 13 through 15, and these are on the coast in South Mississippi. Some of the other things to consider, each region also has a mobile crisis unit that is a 24/7 number, and you can call this number if you're experiencing a mental health crisis, and the person on the other end can give you information about what to do in that moment. And some of these units will even send someone to your location if it's needed.
It's also helpful to just have some of these, some of this information in your wallet, regardless. So I carry around the information just so that way, first of all, so I have it for when someone needs it, but also to take away some of the stigma of carrying the numbers. It's not a big deal to have this information, and it's just very valuable for when something comes up where you really need it.
In addition to the resources that the state of Mississippi has to offer, and that perhaps your public schools might have to offer, we have some additional phone numbers here. These are for national resources. So the National Suicide Prevention Lifeline, we've got the phone number listed there, the 1-800-273-8255. And they also have a number for Spanish-speaking individuals that's listed, the 1-888-628-9454. And then additionally, they have a text line. So if perhaps you don't want to speak with someone on the phone, but you feel more comfortable texting, you can text 741-741 and you'll get a response. And these are 24 hours a day, 7 days a week phone numbers. Some of the other phone numbers that are listed are for specific populations that are experiencing maybe a shared difficulty. So for example, the disaster distress helpline might be for individuals who have recently experienced maybe a tornado. I know we had some tornadoes even in our state a few days ago, or perhaps a house fire. Anyone who's experienced kind kind of a natural or a man-made disaster could call that phone number and talk with someone on the other end who's going to recognize that perhaps the person is having feelings of self-harm or thoughts of suicide in addition to experiencing perhaps a disaster. The numbers we've got listed at the bottom, the Trans Lifeline and the Trevor Project phone number, those are for individuals who are within the lesbian, gay, bisexual, and transgender community. We've listed those because we do know that there's a higher rate of suicide within some communities. And we wanted to demonstrate that there are lots of different resources for individuals out there. So again, when you're having thoughts of maybe hurting yourself, it's nice sometimes when you call one of these numbers to know that the person on the other end can kind of see where you're coming from or identify where you're coming from. They understand your situation.
And these numbers aren't like calling 911. They're really designed to be there, as an earlier intervention. So this would be, when you're starting to struggle, especially right now with the isolation, reaching out. And a lot of people are, and that's been awesome. Like I saw a statistic recently that I believe the text line is seeing almost a doubling of the number of people that are communicating via text, which is great. So you're not alone if you're reaching out to them. And don't be afraid to reach out to them.
So the last step is follow-up, and I'm going to hand it off to Dr. Michael Nadorff.
So the last thing that we want to talk about are what are ways to follow up with Sam or follow up with Alex. So we often think, as soon as we make a referral, so maybe it is, I'm sitting with the individual and we call one of the hotlines together and I link them with services. We feel like we're done, but it's still good to follow up, a couple days, a week later to see how people are doing and to make sure that everything went through without a snag. So can you think of some ways that you might want to follow up with Sam or Alex?
I'm a big texter, so I know that I would be texting to follow up with Sam.
Yeah, I would definitely give a call. And I think that people who typically are opposed to this whole technology thing right now are leaning into it a little bit more. And so maybe scheduling, some kind of web call where we can kind of see each other for, just a few seconds. Is probably what I would do.
Yeah.
We've been doing a lot of FaceTime calls in my family between the little one and grandparents.
Yeah.
Yeah, it doesn't take it's not a big thing. There's a lot of research that shows that even very little interventions, even something as small as sending a friendly note and saying that you care can actually have marked, impact on suicidality. So you don't have to do this huge, big intervention in order to have a really meaningful impact. So with that, again, we want to thank you for virtually attending our training today. If you want to learn more, or if once we're able to travel again, you'd like to request that we come and do this in your community, we will come to you for free. So please contact Rachel-Clair Franklin at the email. And again, if you are a healthcare professional or a mental health professional, again, we really thank you for joining us, especially during this time. And thank you for your service on the front lines. If you'd please send Rachel-Clair a email as well. We have to count those numbers separately, so it just helps us with that. That's the only reason we ask. So with that, we wish you the very best during this time. Please stay safe. And if there's something our project can do to help, please please feel free to reach out to us, and we will do everything we can. Have a great day.